All right, today we're jumping into a condition that's behind a lot of chronic back and leg pain for millions of people: lumbar spinal stenosis. We're going to break down what it is and, more importantly, what you can do about it.
So, have you ever wondered about this? For millions of people, this isn't some abstract question. It's their daily reality. The simple act of taking a walk can set off a whole wave of pain. And very often, the answer is a condition called lumbar spinal stenosis, or LSS for short.
Okay, so where do we even begin? Well, it all starts with the symptoms. You can think of these as the first few crucial pieces of a really painful puzzle that you and your doctor have to put together. The first clues, they often show up in this really classic pattern. It's not just random pain, it's a pain that gets worse when you're walking, but, and this is the key part, it gets better when you lean forward. This is so common that it's actually nicknamed the shopping cart sign, and for doctors, that's a huge tell. And this whole cluster of symptoms, it actually has a technical name: neurogenic claudication. It's really the hallmark of LSS. See, the pain is coming from your nerves getting compressed, and when you bend forward, you're creating just a little bit more space in your spine, which takes the pressure off for a moment. Okay, so that's the what, but what about the why? What's actually going on inside your spine to cause this very specific kind of pain? Let's take a look under the hood, so to speak. Really, when you boil it down, LSS is a kind of plumbing problem for your back. The spinal canal, that's the bony tunnel that protects your nerves, it starts to get narrower. It's literally like a traffic jam for your nerves. The highway they travel on starts to get squeezed. And this MRI here, wow, it gives us a fantastic look at exactly what we're talking about. You can see how that canal is being pinched from different sides. That constriction is what's putting all that pressure on those delicate nerve roots trying to pass through. So what's causing all this narrowing? Well, it's not just one thing. It's usually a combination of things that happen as we get older. Your discs can start to bulge, the ligaments in your spine can get thicker, and your joints can get bigger. All of these things start to eat up the space inside that canal. Okay, here's something really interesting from the research. For some reason, while LSS can affect anyone, it shows up 3 to 5 times more often in women than in men. Now, the sources don't really say why, but it's a pretty significant pattern that they've noticed. All right, so we know the symptoms, we know the potential causes. How do doctors actually put it all together and say, yep, this is definitely LSS? Let's walk through how they figure it out. Well, it's a really careful process. It's not just a single test. It starts with a simple conversation about your symptoms, then moves into a physical exam where they check your strength and reflexes, and then finally, they use imaging to actually see inside your back. And when it comes to imaging, doctors have a couple of tools. An X-ray is great for looking at the bones, you can see the overall alignment, but the MRI, like you see here on the right, that's really the gold standard. It lets them see all the soft tissues, the discs, the nerves, and confirm exactly where that squeezing is happening. But this is where it gets super interesting, and it's a really crucial point. What the research shows is that the picture on the MRI doesn't always match the person's pain. You could have someone whose scan looks terrible, but they feel totally fine, and someone else with just a little narrowing who's in agony. That's why good doctors always say, treat the patient, not just the scan. Okay, so you've got the diagnosis. LSS is confirmed. Now what? The next step, of course, is all about finding relief. So let's look at the options. When it comes to treatment, you can basically think of it as 2 main roads you can go down: the non-surgical path and the surgical path. One is all about managing the symptoms, and the other is about physically fixing the problem that's causing them. For a lot of folks, especially if the symptoms are mild to moderate, this non-surgical toolkit is where you start. It's often a mix of things: physical therapy to build up support, medications to calm down inflammation, and maybe even injections to soothe those irritated nerves. For many, this brings a ton of relief. But what if that doesn't work? For people whose pain just won't quit and really starts to mess with their life, that's when surgery comes into the picture. And just look at this pre-op MRI. The arrows are pointing to where those nerves are getting seriously squeezed. The whole goal of surgery is to go in there and create more room. Now, sometimes when the surgeon removes the stuff that's pinching the nerve, it can make that part of the spine a little, well, wobbly. In those cases, they might also do what's called a fusion. They use hardware, like what you see on this X-ray, to make that section of the spine strong and stable again. And it's just amazing what modern surgery can do. These techniques are so precise. What you're looking at here is what the surgeon actually sees during a minimally invasive surgery. You can see the nerve roots are now free, they have space to breathe, and this kind of surgery often means a much faster recovery. Okay, so that's the treatment, but what happens next? What does the road to recovery actually look like? What can people expect? And this is really fascinating. When you look at the research long term, years down the road, both the surgical and non surgical treatments can end up in a pretty similar place. But the big difference is in the short term. Surgery often gives you faster, more significant relief right out of the gate.
And when it comes to surgery, the results are really good. We're talking about an 80% success rate. That's about 8 out of 10 people who say, yep, this was successful, and that it really helped relieve their symptoms and get them back to their daily life.
And this is a really important point to end on. The benefit of this surgery isn't just about getting rid of pain. It's so much more than that. LSS can cause weakness and balance problems, and for older folks, that means a higher risk of falling. So by freeing up those nerves, surgery can actually improve strength and balance, which is huge for safety and overall quality of life. So we'll leave you with this thought. Is just understanding what's going on with your body the first and maybe the most powerful step you can take? When you get what's causing the pain, how it's diagnosed, and what your options are, you're no longer just a passenger. You're in the driver's seat, ready to have better conversations with your doctor and take control of your journey back to a life with less pain.